There was a fire in the early morning of April 13th, 1918. The fire started in a linen closet of the ground floor of Ward 14. The fire spread fast through that ward and went on into two other patient care wards and also to the dining room. Ward 14 was evacuated as much as possible. The majority of the deaths happened in that Ward 14, and there was one death in Ward 15. 4 buildings in total were demolished by the fire, and 300 lives were saved. One of the articles written early after the fire talked about the experiences of 2 of the firemen and how fast the fire spread and how helpless they felt in terms of evacuating the patients to safety. Having to leave patients who were suffering in those buildings as they burned. Some of the stories that we read about talk how, for sanitary purposes, many of the walls were covered with paraffin so that they were easy to wash down, which just fueled the fire and made it burn even hotter and faster in that loss of life. In 1917, the legislature had passed laws to construct new buildings. And because of delays, they had not been built, and so there were many unsafe buildings on the campus. And the positive thing that came out of this fire was all buildings on the hospital grounds were then of brick construction and had fire protection system as much as possible for that day. This is the culmination of probably 10 years of work that several individuals at the hospital have done, researching our medical records, looking at the inquests, looking at articles written about the fire, and to see them memorialized and there actually be a stone erected to commemorate their loss is very fulfilling.